So today we're setting up some fluid therapy for a 20 kg dog who's 7% dehydrated, and we're going to be using a 10 drop giving set. We're going to correct the fluid deficit over the first 6 hours, which we've come up with the drip rate of 3 drops every 4 seconds, and then for the remainder of the 24 hours over the next 18 hours we'll be continuing with the maintenance at a rate of 1 drop every 8 seconds. So first off, we're going to connect our giving set to the fluid bag. So we've got our giving set here. First thing we're going to do is make sure that the line is closed off using the roller here, and then we're going to get our fluid bag. We're going to remove the cap here, making sure not to touch that area as it is sterile, and then we're going to remove the cap of the giving set, also making sure not to touch that as that is sterile as well. Then we're just going to connect those two together by just pushing it right in there. Okay, so now that that's connected, we're going to want to fill the chamber about halfway. So just give it a squeeze until you've got the right amount of fluid there. And so next we're going to run the line to make sure that we remove all the air bubbles. So you're going to remove the cap at the end here that gets connected to the patient. Make sure not to touch that area as that is sterile as well. And then you're just going to roll the barrel back down so that the fluid is able to flow freely through the giving set. And all the air bubbles will drip out. So once you're happy with all the air bubbles being gone from your line, you just want to close it back off. And at this stage you can label your fluid bag. So best thing to do would be put a piece of masking tape on the bag so that the pen doesn't puncture the bag, and you're going to want to write the date that it was opened and if you add anything to your bag, like any vitamins or anything like that. So then what you're going to do is set the drip rate. So to do that you're going to want to look at your chamber, and you can slowly release the roller to allow fluid to drip through. As you can see, if you release it more fluid goes through. If you tighten it back a bit, you get less drops per second. So you just want to time the amount of seconds that you're wanting and just count how many drops you get. And so after that you're free to attach it to the patient.